My name is Dr. Chris Raynor, and today I am reacting to YouTube comments on my video about the role of chiropractic therapy. It seems that the internet gets salty when you speak less than favorably about chiropractors. So today, I'm going to look at some of these comments to see just what all the fuss is about.
Ladies and gentlemen, can I please have your attention?
Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel where I explain orthopedic injuries and sports medicine in a way that's easy to understand for everybody. More content about sports injuries, wrestling, and motocross is just around the corner. And now for something completely different. Before we get started with the heated comments, there are a few things that you should know about my practice. I will say this now in case you don't watch the whole video and miss this later on. First, I do not think that surgery or medications are the only solution to your musculoskeletal problems. I have never advocated this position. I am an advocate of active, progressive exercise therapy and patient independence for non-surgical problems. Second, I do not work for any pharmaceutical company, nor have I ever, and I have not been paid by one. I am not in the habit of prescribing pain medication for patients who have not had surgery, and I don't plan to start doing so. Third, I have always advised patients to exhaust all appropriate non-surgical and non-pharmacologic treatments before they consider operative treatment for their problem. So now, with all of that out of the way, let me put on my fireproof suit and let's get to the roasting. Okay, so the first comment comes from Scott Smith. His main points are that there are many medical malpractice lawsuits versus few for chiros, that medical doctors have created a drug problem, and that surgery should only be considered in life-threatening circumstances. While I don't have any relative stats for medical lawsuits available for review here, it is likely true that there are more medical malpractice suits than there are chiropractic suits. The medical field is orders of magnitude larger than the field of chiropractic, which deals with only a small subset of musculoskeletal problems. Comparing chiropractic suits to all of medical suits is inaccurate. It would be more accurate to compare medical suits from non-surgical spine diagnoses to chiropractic suits. Then you would be comparing apples to apples instead of comparing orchards to apples. In my previous video, I said that cervical manipulation was inherently risky with potentially devastating complications that could be avoided with other non-surgical treatments. A lower amount of chiropractic lawsuits does not change this. No one wants a vertebral artery dissection or a stroke from a manipulation. While there is an issue with narcotic use in many patients, it is my position that we should avoid the use of narcotics whenever possible in the treatment of musculoskeletal problems. Doctors find themselves in a difficult position when their patients have pain and are seeking immediate relief, but the physician has not yet established a diagnosis of the problem at hand. This often takes time, and unfortunately, many patients are not willing to wait for the completion of this process. They want their pain to be relieved immediately, whether by drugs or chiropractic manipulation, and they are not interested in putting in the work that is required to correct the issue that caused their pain symptoms. Like drugs, chiropractic therapy treats symptoms and provides temporary relief. Lasting relief requires exercise and training to correct the imbalances, poor posture, and abnormal mechanics leading to the problem causing the pain. Some people are addicted to medications. Others are addicted to manipulations. Neither get to the point. Fortunately, physicians have recognized the problem with narcotic addiction and are taking steps to reduce the prescribing and the use of narcotics in these patients. As I mentioned in both of my videos on chiropractic care, surgery should always be considered as a treatment only after all valid non-surgical treatments have been exhausted. This includes activity modification, various types of therapy, including physical therapy and chiropractic therapy, and in some cases, medications. If all of these treatments have failed, then that patient may be considered for surgery. May, but not always. This is the standard surgeon's approach. While the indications for surgery are wider than only life-threatening problems, you should try and fail other treatments before you consider surgery. Having said that, there are many problems where I as a surgeon know that the patient will be back for surgical care because the non-surgical options are unlikely to provide the results that the patient wants. My only advice to potential patients is not to wait too long so that the damage is not worse when surgery is attempted. The next comment is from Zachary F. He claims that most people still suffer back pain post-operatively and speaks to the high rate of satisfaction with chiropractic treatment. He suspects that I am threatened by the ability of chiropractors to make people feel better in only a single visit. Spinal problems that require surgery include those that demonstrate either structural or neurological instability. Either the vertebrae cannot maintain their normal position relative to one another, or they put unacceptable pressure on nerves or the spinal cord. These are the indications for surgery. Both of these problems cause pain, as well as other issues. By the time that people are offered surgery, usually they have one or both of these problems. A surgeon attempts to alleviate the pain symptoms by correcting these problems and restoring stability to the spine. This is not always successful, and some patients can continue to have pain after surgery. However, patients who have structural or neurological instability are not appropriate chiropractic candidates. Back problems that are treatable by chiropractic therapy are relatively minor in nature and relate to muscular imbalances. Zach makes the point that chiropractors can make people feel better in only a single visit. This is one of my main points exactly. Chiropractic care is a form of symptomatic treatment. Your back hurts, you go see a chiropractor. The chiropractor performs a manipulation and you momentarily feel better. You leave satisfied that you have done something. After leaving the chiropractor, a short time later, your pain returns and then you have to, guess what? Go back to the chiropractor for another manipulation to feel better. And so the cycle repeats itself. You would expect chiropractors to have high rates of satisfaction since every time you go to them, you leave feeling better. But feeling better and actually being better are not exactly the same thing. If your back pain is caused by muscular imbalance, but you get a manipulation and it temporarily feels better, you haven't fixed the problem. You have only pushed off its presentation until a later time. However, if you fix the problem with appropriate active rehabilitation and training, you get rid of the pain for good. People take heroin because it makes them feel good every time they take it. It doesn't make heroin good for you, so that logic just isn't quite valid. And believe it or not, I am not threatened by chiropractors. I am not a spine surgeon and I generally don't treat back pain patients. I do, however, review treatment plans for chiropractors and physiotherapists for legal cases, workplace accidents, and motor vehicle accidents. After reviewing over 600 cases, I can assure you that chiropractic care is often not the quickest nor the most sure form of treatment. Okay, so how about Mike S? Basically, I am a typical surgeon and I give props to myself and shade to chiros. He implies we put instrumentation in everyone to straighten them out. At least he admits there are some unskilled chiros. Thanks, Mike S. I don't minimize what chiros do. Chiros play a role in the treatment of non-surgical musculoskeletal problems. Their role is primarily on the therapeutic or the treatment side of the spectrum. Chiropractors have access to a limited set of diagnostic modalities. They treat a limited set of musculoskeletal problems with a limited set of tools. Their role is similar to that of physiotherapists, although their treatment options are more limited and focused. As surgeons, we are not looking to put rods or instrumentation in everyone to straighten them out. We do use instrumentation to restore stability and to correct alignment of the spine when necessary. However, this is not always the case, nor is it the goal. Generally, from a surgical perspective, less instrumentation is usually the goal. The least amount of instrumentation that can be implanted to correct the problem is the best. Some surgical patients can be treated without instrumentation if we do not need to remove any bone or if there has been no change to the structure of the spine. Instrumentation can become colonized by bacteria and infected, so we try not to use it when we don't have to. If you have a problem that requires a chiropractor, then you don't need a surgeon. Period. How about Kelly H, who feels that I have missed the point? He failed treatment with an epidural and narcotics and received relief only after a chiro was able to manipulate the bone away from the nerve. It's great that Kelly attempted other modalities of treatment and all, but nowhere in his comment does he mention the exercise, education, and training that would have helped him with his problem. These are the core principles of treatment for mechanical back pain or sciatica. Jumping to narcotics or epidurals without exhausting active progressive exercise training doesn't make sense and is like approaching the problem backwards. Also, people have this impression that the bones of the spine can be easily maneuvered around by spinal manipulation. This is not the case. The bones are held firmly in place by their attached ligaments and the surrounding muscles. You cannot push a vertebrae away from the nerve root or the spinal cord. If you were able to do this, the spine would be unstable in that area and sciatica would be the least of your freaking problems. So while Kelly may have experienced relief from his chiro treatment, his chiro was certainly not moving the bone away from the nerve. Not. Goran Tomac states that chiros have been treating people since ancient times that predated technology and radiographic imaging. Apparently, Goran is not aware that chiropractic care was invented by a Canadian spiritualist, Daniel Palmer, in the late 1800s. He revealed that the idea for chiropractic care came to him from the other world during a seance while he was communicating with the spirit of a physician, Jim Atkinson, who had died 50 years earlier. Palmer worked as a school teacher, beekeeper, and a magnetic healer. He stated that 95% of all disease was caused by subluxations. In chiropractic care, subluxations occur when one or more bones of the spine move out of place and put pressure on spinal nerves. This pressure causes many different diseases by interfering with the flow of nerve impulses between the brain and the body, supposedly. However, there is not evidence to support the subluxation theory or the use of spinal manipulation for anything other than uncomplicated neck or back pain. Chiropractic care is not so ancient as Goran believes. And with 100 years of technology with which to confirm the subluxation theory, it is odd that no chiropractor has done this yet. If they want to continue to promote these theories, then they should use accepted science principles to prove their validity and to understand how they work. Not medical principles, scientific principles. Level 3 or above evidence, double-blinded, randomized control, prospective study. Or better yet, a meta-analysis. Because that's how scientists prove their work. For the last one, let's look at Brian Burgess. Apparently, I'm not a doctor and definitely not a surgeon. I guess he really got me there. Bruh. I'll have to let everyone at the hospital and at my office know. But seriously, that is really not the way to prove anything about chiropractic care. If you enjoy what I do and the information that I provide, then consider becoming a member of the channel or my Patreon page. I'll be posting all of my content from various sources over there because YouTube doesn't seem to like injuries and my videos are often demonetized. If you enjoy podcasts and you haven't already, be sure to subscribe to my new podcast channel. I'll leave a link down in the description below. And if you're looking for exercises and workouts, or if you want information on injury prevention, check out our sister channel, Human 2.0. Thanks for watching, and as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.